طيب الانكل fracture زي يعني يبغاكم تعرفون لأنه very common. So it's most common weight bearing skeletal injury. The incidence has increased. طبعا هذه Western numbers. The highest incidence rate in elderly women. Usually it's unimalleolar. طيب شلون يعني malleolar؟ البارت هذا من الفيبولا، آخر البارت من الفيبولا is called lateral malleolus. والميديال or this part of the tibia is called medial malleolus. So medial malleolus, lateral malleolus, and the posterior part of the tibia is called posterior malleolus. So medial malleolus, lateral malleolus, posterior malleolus. Usually it's very common or highest number of cases is unimalleolar. So either a lateral malleolus or a medial malleolus. Okay. It can be bimalleolar يعني يكون medial and lateral أو trimalleolar يعني medial lateral and posterior. It's very rare to be open. Spondylosis anatomy, the fibula and the tibia. We call something we call ankle mortise, where the ankle, this area اللي من الميديال malleolus إلى اللاترال malleolus مع التيرس بون اللي هو هذا من جاي التيرس بون هنا بالوسط، هذه اسمه سمى mortis. They called a mortis. طيب. These are the lateral ligaments. This is the medial ligament. There is something very important called syndesmotic anatomy, and this structure helps in maintaining the or keeping the relationship between tibia and fibula. تمام. فهذا أول شيء هو الليجمنت اللي تمسك between the two bones. The interosseous ligament is one of these. Then anterior inferior tibiofibular ligament, posterior inferior tibiofibular ligament. Okay, and interosseous membrane. تمام. هذه كلها بارت من اللي هو syndesmotic anatomy. Always when taking history, ask for mechanism of injury, time since injury, soft tissue injury. Has the patient ambulated on the ankle? Patient age, bone quality, associated injuries, comorbidity. Physical examination, neurovascular, not obvious deformities, pain over the medial or lateral malleoli, palpation of ligaments about the ankle, palpation of proximal fibula, lateral process of the talus, base of fifth metatarsal bone. Then, and examine the hand, foot, and forefoot to rule out any associated fractures. Then get all the images of the foot and ankle, like AP ankle, lateral mortise of ankle. Always get weight bearing images if possible. You might need the knee, and also you might need the foot X-rays if there is an indication. طيب For the first one, which is called the anterior posterior view of the ankle, anterior posterior view of the ankle, then there is measurements that we can uh, see or look at in this view. So first of all, we look at this area here, and this is called this area here. So if you see, look closely, the fibula coming from here all the way down here. The tibia is going somewhere like this, I think. Yeah, going this way. Then هذا المكان هذا is called overlap. زين يعني التibia والفيبيولا هنا they overlap. خلاص المنطقة هذه is called clear space. clear space يعني ما في تشوف تشوف ما في density هنا. هنا لا، هنا في density. اوكي. طيب وش الهدف منهن؟ وش الهدف من الميجرمنتس هذه؟ عشان نشوف هل لو تباعد العظمين هذين بعض، يعني هذا العظم راح كذا، وش بيصير للمنطقة دي؟ تبي تقل، يعني الأوفرلاب يقل والكلير سبيس يزيد. خلاص هذا فعشان كذا احنا نشوفه حتى نتأكد إنه ما فيه سندسموتيك. فهذه الكلير الأوفرلاب it has to be less than 10 millimeter. It has to be less than 10 millimeter. لا عفوا، less than 2 millimeter is abnormal. خلاص 10 millimeter أو more هذا النورمال. كل ما قلت this is an abnormal and it implies a syndesmotic injury. التibiofibular clear space المفروض تصير أقل من 5 millimeter, so more than 5 millimeter is abnormal, and this implies a syndesmotic injury. And a tailor tilt. tailor tilt هذه نشوف فيها space اللي between the distal tibia اللي هنا distal tibia والتيرس. هذه المسافة دي is 2 millimeter. It's more than 2 millimeters considered abnormal. طيب وش في بعد other angles or other parameters في الانكل mortise view. المورتيس فيو انك تاخذ تخلي الفوت is internal rotated and the projection is يعني تاخذ you take an AP view of the ankle with the foot is internal rotated about 10 degrees. It's called mortise view. طيب what are abnormal findings? Medial joint space widening. تمام. And talocrural angle which is an angle between the angles اللي between the tips هذه tip of medial malleolus to tip of the lateral malleolus والline هذا. So vertical line وline between this and this. Then ونشوف الانجل. Normally it's 80, 83 plus minus 4. طيب في lateral view you look at posterior malleolus, anterior posterior subluxation of the talus and the tibia, displacement of the fibula, and any associated injuries. طيب بالنسبة classification, there is Lodgy-Hansen classification. And there is Weber-Denny classification, which is ABC. طيب بالنسبة للمانجمنت. So for management, if there is a dislocation, then close reduction, then put on a splint, any type of splint, splint or other splint, and delayed fixation until soft tissue is stable. So if there is swelling, then uh, delay the fixation until the soft tissue subsides, the swelling subsides. And pain control, of course, and monitor for possible compartment syndrome and high energy injuries. طيب, if you have an undisplaced fracture with intact syndesmosis, then this is indication for non-operative care. For the fibula, if the displacement is less than 3 millimeters, consider this indication for uh, um, non-operative treatment with short leg cast or cam boots for 4 to 6 weeks. For any bimalleolar fracture, trimalleolar, pterosubluxation, all these are treated with open reduction tear fixation. Then open reduction tear fixation, or the fibula, usually it's plate. Medial malleolus is cancer screws or tension band, wire, posterior malleolus, open reduction tear fixation with screws. Syndesmosis is also with screws. That fracture is not common, but the most important thing I want you to focus on is that uh, any displacement in this fracture, even small displacement, 1 millimeter, needs treatment with open reduction tear fixation, because this fracture or any fracture in the talus can lead to osteonecrosis or varus malunion and post-traumatic arthritis. Calcaneum is more frequent than talus, and it's the most frequent tarsal fracture. It's usually with high energy and axial loading. Um, a small percentage of fractures are associated with compression fractures of thoracic or lumbar spine, and majority are intra-articular and 10% are bilateral. Always get an AP and lateral views. CT scan is the gold standard. And MRI is for stress fractures. Mostly these are treated conservatively with immobilization and non-weight bearing for 10 to 12 weeks. Any tongue type fracture, displaced, articular, these are treated with surgery. So this is tongue type fracture, as you can see here, the posterior part. This fracture can lead to skin necrosis and converting this fracture to open fracture, which is which needs an urgent treatment. طيب نجي على fifth metatarsal base fifth metatarsal fracture. It's a very common fracture patterns. So usually it's divided into three zones, zone one and two, three. Zone two is called Jones. And so zone one is pseudojones. So what is zone one? Zone one is the most proximal part. Immediately after that, that's the joint level. Okay. So this zone is zone one. Then zone two, Jones at the joint line, joint area. Distal to that is called zone three, which does not have a name, but Jones, the pseudo Jones are for zone one and two. So this fracture is in zone two. This is Jones fracture. طيب treatment of um, base of fifth metatarsal fracture. Base of fifth metatarsal fracture is treated with non-operative means most of the times, but occasionally treated with screws, especially in patients who are athletes who want to go back to sports immediately. But this frank fracture, this frank is the between the medial cuneiform and the middle or the second metatarsal. This area. Usually finds whitening, the flick sign in here. Dorsal displacement, dorsal displacement. And these usually are treated with upper reduction and fixation. Okay.